In this video, I'll talk about the most common type 2 diabetes symptoms. In some cases, you may have type 2 diabetes and not notice any symptoms. In some cases, people live with type 2 diabetes for several years before being diagnosed. And of course, the sooner you find out that you have type 2 diabetes, the better, because you will be able to take action early and prevent future complications related to type 2 diabetes, things like heart attacks, stroke, and blindness. I will share the most common type 2 diabetes symptoms. So if you notice any of these type 2 diabetes symptoms, you should get your blood glucose tested. You can either do it at home or with your doctor. So the first type 2 diabetes symptom is frequent urination, especially during the night. When your blood sugar levels are too high, the kidneys try to remove the excess sugar by filtering it out of the blood. This can lead to frequent urination, especially during the night. Then the next type 2 diabetes symptom is excessive thirst. These are both linked. You have frequent urination to clear out excess glucose, and you get dehydration, which leads to excessive thirst. The third type 2 diabetes symptom is having dry mouth. This can also include having trouble chewing or swallowing your food, and having dry, cracked lips. This might happen because of excess glucose causing dehydration. Next type 2 diabetes symptom is increased hunger and cravings. Insulin resistance is one of the major features of type 2 diabetes. When you eat food that contains dietary carbohydrates, these get broken down into glucose. Due to insulin resistance, your cells are not letting glucose in. This can result in you eating, but the energy from the food not giving you energy and being stored as body fat instead. It's like you're hungry, you eat, but the food disappears, and you're just getting bigger. If you're always hungry, that could be a sign of insulin resistance or type 2 diabetes. The fifth type 2 diabetes symptom, dry, itchy skin. Itchy skin is often caused by type 2 diabetes. It can be one of the earliest diabetes symptoms. It can be caused by a variety of reasons, including yeast or fungal infections or poor circulation, especially in lower legs. Next type 2 diabetes symptom, number 6, is slow healing wounds. Having high blood sugar levels or hyperglycemia narrows your blood vessels, slowing blood circulation and restricting the supply of nutrients and oxygen to healing tissues. When you have elevated blood glucose levels for a prolonged period of time, it also weakens your immune system, leading to your body being not able to protect itself from infections. Vitamin C, that is so crucial for a well-functioning immune system, is structurally similar to glucose. Glucose competes with vitamin C for getting into the cell. So if your blood sugar is constantly elevated, it is very likely that you have vitamin C deficiency and you often get sick. Then the seventh sign of type 2 diabetes, often feeling tired. This comes back to impaired glucose metabolism, lack of energy for the cells, and unstable blood sugar levels. To feel great throughout the day, our blood glucose levels should be stable. We shouldn't have hypoglycemia or hyperglycemia. Our blood glucose should remain as stable as possible before meals and after meals. Stable optimal blood glucose levels result in stable energy and mood. This brings me to the next symptom of type 2 diabetes, irritability or mood swings. Are you often feeling annoyed? This could indicate that you have diabetes, type 1 or type 2. Rapid changes in your blood glucose levels when your glucose is too low or too high can cause drastic mood changes. There's something called diabetic rage. That's a state where blood glucose fluctuations cause extreme anger in diabetics. So it's very important to keep blood glucose stable to prevent these extreme mood swings. Then the ninth symptom of type 2 diabetes is blurry vision. Blurry vision is typically defined as the inability to see clearly. Any type of blood fluctuations, low or high blood sugar levels, can cause blurry vision. High blood sugar levels can cause swelling of the eye's lens. The lens is responsible for focusing. This is not permanent, and vision returns back to normal when blood sugar levels fall within a normal range. But over time, uncontrolled elevated blood glucose or hyperglycemia can cause damage to the blood vessels in your eyes. When the capillaries in the retina become damaged, you can develop diabetic retinopathy, a serious eye disease that can lead to blindness. And the last type 2 diabetes symptom, numbness and tingling in your hands or feet. So if you experience tingling or numbness in your hands, fingers, feet or toes, it is a sign of nerve damage or diabetic neuropathy. If you have this symptom, definitely see your doctor. And as always, if you have any of these symptoms, don't panic. Type 2 diabetes can be reversed with a proper diet and lifestyle. I have many useful videos about blood glucose control and type 2 diabetes. You can watch some of them after. By the way, if you're new to my YouTube channel, my name is Greta and I'm an online nutritionist and a holistic health coach. If you haven't yet, subscribe to my YouTube channel. And if you found this video useful, feel free to share it with your friends and family. Thanks so much for watching, and I hope to see you in the next video.